Lung Cancer by Paul.Stanley III. Alright, you guys ready to learn? Because I know I am. Got my paper here. Yeah, don't need paper. First off, symptoms. There are many symptoms to this wretched disease, but first off, we have a cough most of the time. Then we also have a change in a cough you have had for a long time. Oh, don't forget a shortness of breath. Also, coughing up phlegm is also a sign of it. An ache or pain when breathing or coughing, that as well. Loss of appetite and fatigue, both of those. And also the loss of a lot of weight. The methods of diagnosis, there's a couple of them. First one is sputum cytology. A sample of coughed up mucus is taken and is checked for cancer cells. Seems efficient. After that, we have chest x-ray. A x-ray of the chest is taken to check for cancer cells. Alright. Apparently that guy did not have a good day. And then after that, we have bronchoscopy, in which they look down your trachea and large airways with a thin, light tube where it can also pick up samples if need be. That looks painful. And so after that, we have the electromagnetic navigational bronchoscopy. That is a mouthful. Basically, they stick this like camera thingy down your throat into your lungs and take a 3D image of it, so you then get a very weird looking Mario Kart track. So next we have the endobronchial ultrasound. Wait, what? I can't read my handwriting. This takes a ultrasound of your lungs, in which if there is an area in question that is needed for a sample, they stick a needle down your windpipe and take a sample. Right. Alright. Don't forget our favorite one, the needle aspiration, in which they take a needle, they stab it into your tumor, and take a sample. So now we have the thoracinesis, as it's possibly pronounced, where you take a needle, stab it in between your ribs, and take a sample of the fluid stuff. Very scientific, if I do say so. I wonder how much fluid they take. Oh, Jesus! Mom! Mom, change it! Please, I don't know. Thank you. Oh, God. And next we have the thoracoscopy, in which a camera on a thin tube is used to go through an incision to look at your lungs. Yes, children, that is not the miracle of childbirth. That is a very healthy lung. And last but not least, there is thoracotomy, in which they open up your chest. Well, I mean, the image can't be that. Oh, God, get rid of it now. Please, someone, please get. Thank you. Oh, my. Oh. Now, some of the many causes of lung cancer are smoking, obviously, so I'm going to skip over that because we've all heard this a quadrillion billion times. But a different one is radon exposure. This colorless, odorless, radioactive gas that naturally appears in soil, in which if it goes up through holes in your homes and you inhale it, you can get lung cancer. So yeah. Also, fun fact, 1 out of every 15 homes has this. So, be sure to have your home checked, because if you don't, you might get lung cancer. Another one that just might blow your mind is industrial exposures, where working with elements that are radioactive and poisonous, and are just generally dangerous, can give you lung cancer. Shocking, I know. Oh, also, if your great-great-great-great-grandma Shooter Watsamidbadubidibidin had lung cancer, there is still a possibility you might, because it's also, there's a genetic factor in which you could possibly have it. If one of your parents or grandparents or great-grandma Shubajibajabajibadubin had it as well. Oh, and also there was a very small percentile of people who are perfectly normal, living healthy, wonderful lives, and they get it for no reason whatsoever. There still needs to be research into this to figure out why, but yeah, so there's like a 0.0000001% of a chance you could get lung cancer. Now there's a couple of surgeries to this disease, in which the first one is a wedge resection, where they cut out the chunk of the lung, which has the cancer cells on it, as well as some healthy tissue. Next we have the segmental resection, which removes a large portion of the lung, but not the entire lobe. In which after that we have a lobectomy, which removes the entire lobe of one lung. And finally we have the pneumectomy, in which it removes an entire lung. As well as the side effects of all of these combined are usually pain, it's harder to breathe, and lightheadedness, but obviously because you're not getting enough oxygen to the brain. After that, we have chemotherapy, which uses drugs to kill cancer cells. You take it either through veins or orally. Sometimes it is used as a first-line treatment, but you can also have it after treatment, after surgery. Not only that, but chemo can be used to lessen the side effects of cancer. Some side effects from chemo are fatigue, pain, sores in the mouth and throat, diarrhea, nausea and vomiting, constipation, blood disorders, change in thinking and memory, sexual reproductive issues, appetite loss, and hair loss. In which another type of surgery is radiation therapy. This uses a high-powered energy beam, such as X-rays, to kill cancer cells, in which it can be directed straight to the lung or through a needle. How do you put a laser in a needle? Someone Google that for me. Anyway, after that we have targeted drug therapy. There are a few different drugs you can use, like whatever that word is, also known as Avastin, in which it stops tumors from creating new blood supplies, in which they stop blood flow to the tumor and make sure it doesn't really get any bigger. And now we have that word, which is also known as Tarseva, which blocks the chemicals that signal the cancer cells to grow and divide, so again, they don't get any bigger. Now there's that thing, which is also known as Xalcore, in which it blocks chemicals that allow cancer cells to grow out of control and live longer than normal cells. And if none of those work for you, you still have one last possible thing to do, which is clinical trials. The studies of experimental lung cancer treatments recommended for people who have not had success with other treatments. Kind of like a last resort sort of thing. And if none of those work whatsoever, you can always try supportive care, where this is not for those who want a cure. This only has doctors stop the symptoms as you slowly die. But on the brighter side, most people who do this live 3 months longer. It's not really a cure or anything, it's just kind of extending your life as you slowly perish away. For an outcome, nearly 160,000 people died in 2012, more than colon, breast, pancreas, and prostate cancer combined. Also, only about 52.6% of people who are diagnosed with lung cancer over 5 years survive. That is all, and thank you for watching. Hope you all have a wonderful day, and I'm gonna go take a nap.